Hi, I am Dr. Rizwan Khaled from Pakistan. Today I will discuss diabetes type 2 and we call it as seven leading cause of death diabetes mellitus. There are two major types of diabetes. First diabetes type 1 and second diabetes type 2. In diabetes type 1 our pancreas cannot produce insulin, and in type 2 diabetes our pancreas produce insulin and not enough for our body. Pancreas produce less insulin. There are two theories about type 2 diabetes. Or our pancreas is producing insulin in too much quantity or less quantity. About Jerry theory, Gerard is a scientist and a dietitian. About Gerard, Gerard says that this theory is very important in diabetes. Gerard says our pancreas in type 2 diabetes is producing full insulin, and but our body cells or our body is not responding insulin. Our cells or our body not responding insulin. It is a insulin. It is called a insulin resistance. So we describe that insulin is a major and important vital for our living, because insulin in our body reduces the sugar level in our blood. If insulin does not produce in our body, our blood sugar level become too much high. So we think many other ways, and every scientist and researcher gave their own theory. The doctor are failed to treatment diabetes because the researcher and medical drugs and drugs pharmaceuticals companies are giving a deceive with human lives. WHO first 40 or 30 years ago presented a theory and recommended that 200 milligram sugar is a normal. Later on, in 1880, the theory WHO changed and came diabetes normal value 180 mg per deciliter. And later on, in 2000 or 2005 and 2010, reduces the level, normal level to 140 and 160 level of diabetes called borderline or pre-diabetes. We are deceiving from drugs pharmaceuticals companies because drugs pharmaceutical companies wish their own theory, and they think that our drugs will be sold quickly if the diabetic patients will more in numbers. But it is very cruelty to human bodies. Every human body has a great loss because any diabetic patients when receive or eat and take any diabetic medicine, there are advantages and disadvantages of these medicines. Because for advantage, the patient forced to take medicine. He can do nothing, and doctors can do nothing. WHO presented his theory and recommendations allowed in the world. Pharmaceuticals companies and drugs pharma forced to sell their medicines. Next, I will describe all these theories and I shall explain the new research about diabetes type 1 and diabetes type 2 with healthy diet and exercise in a future. Take care.